I'd like to talk a little bit about hair transplant here at Sand Plastic Surgery, specifically with regards to how we approach hair loss and hair restoration options for our patients. We have patients that come in to see us, both male and female, with areas of thinning, areas of hair loss, and hair transplant is one of the options that's available as a permanent solution for hair restoration. There are other options which include both medical and injectable options, but those are longer-term treatments and not permanent solutions. The benefit of a hair transplant is that it's a natural looking result. It's a long-standing result. It restores the hairline and also restores the confidence for a lot of our patients. This type of procedure actually has relatively minimal downtime compared to a lot of other procedures that are available for hair restoration. As far as the process goes, there are two separate types of techniques that can be used. One technique is called a follicular unit transplantation, or FUT. Another title for that is linear strip excision. The separate technique is called the FUE, or follicular unit extraction. The difference between these two types of treatments basically comes down to patient preference, hairstyle, age, that help determine which type of procedure we'd like to do. As far as the steps of the procedure, we start with harvesting the hair follicles from typically the back of the scalp. How we harvest those hairs from the back of the scalp depends on those things that I was just mentioning. If we're doing the follicular unit transplant or the strip technique, what we're doing is excising a small strip of hair from the back of the head, using that to get out the individual follicles and then transplanting those to help replant the front or maybe the top or maybe just on the sides in order to hit the areas of concern. In that particular type of procedure, the patient has a small linear scar on the back of the head that has sutures in it and are removed about 2 weeks later. The other type of extraction technique is the follicular unit extraction technique, and with that, we're taking out hairs one by one, basically from the back of the hair. We do have to trim the hairs a little bit short in order to harvest those follicles, and it's a little bit more time consuming than the follicular unit transplant, but what you do end up out of that is no linear scarring. And for a lot of our patients that come back after a week and a half for their post-op evaluation, the hair is grown in, the little sites where we took the hairs have completely healed, and it's essentially extremely difficult to tell that we even did anything back there, which makes the FUE version of things a very good option for patients that wear their hair pretty short. As far as recovery goes, for patients that do the FUE technique, you have a bit of a raw area on the back of the scalp for a few days, but usually, like I say, after about 7 to 10 days, it's completely healed, the hair's grown out, and you would not even know that we did anything back there. As far as the strip technique, or taking the hairs as a linear strip from the back of the scalp, the sutures stay in for about 2 weeks, and then there can be a little bit of tightness back there from where the sutures are at. Those get removed. We typically don't shave the hair or anything back there, so if people wear their hair a little bit long, it covers up that incision completely, and that area heals very well. Additional care instructions in the post-op period are that the areas where we transplant the hairs, typically in the front or the sides, we don't want the patient to be manipulating that area much. We do want them to clean it, typically with some baby shampoo that we have them do. We have an instruction sheet that we provide to you to help guide those first few days, which are the most critical as far as the healing process. As far as the results are concerned with hair transplant, what we typically see is after we put the hairs in, there's immediate growth of the hair. They do typically tend to grow for about 4 to 6 weeks. After that 4 to 6 week period, what we see is that the hair shaft will actually fall out of the transplanted follicles. The follicle is still in the scalp, it's still alive, doing fine, but what happens is it goes into a quiescent phase where it sheds the hair that's in there and takes a little bit of time to regroup before it starts to regrow. Typically, we see it about 6 to 8 months after the transplant that the hair cycles all start to sink and the hairs grow, and it becomes the more long-term product that we would expect from the hair transplant. As far as the long-lasting effects of hair restoration, the hair on the top and on the sides are hairs that are affected by male pattern baldness. The hair on the back does not have that genetic makeup, and so when we take the hairs from the back and move them to the front, those are patients' permanent hairs, meaning that they're hairs that do not fall out in a pattern sense. We do have a little bit of hair thinning that happens over time, just generally to the entire scalp, and so they will be subject to that, but it is essentially a permanent solution for hair restoration. So in conclusion, as far as the benefits of hair restoration, what we see is we can take an area where there's thinning, an area where the hairline has been lost, and we can completely restore that area in a way that is natural, that is essentially undetectable, and thickens and provides a wonderful hairline. The results are seen usually several months after the procedure, but as it's healing, it doesn't tend to look too different than how it looks before the transplant until those hairs grow in and start to fill in that area. So if you're interested in learning more about hair restoration, hair transplant, to see if you're a candidate, we would encourage you to schedule a consultation here at Sand Plastic Surgery. You can visit our website at sandplasticsurgery.com to see before and after pictures of patients who've undergone this procedure, as well as further information about the procedure, or give us a call at 509-324-2980 to set up your appointment. Thank you very much.